So now I'm really excited to talk to you about Morpheus, what it does, who's a good candidate, and trifecta. So what's Morpheus? Morpheus is bipolar radio frequency energy in the form of needles. Okay, what does that mean in English? They're these little needles that are coated except for the tip. They come out of a plate on a thing that pushes them out, and it repeats the way we tell it to and goes to the depth that we tell it to. So you have needles that are going from 1 millimeter to 4 millimeter deep on the face to 7 millimeter deep on the body, putting energy at the tip of that needle at the amount of energy that we want, frequency that we want. Okay, what does that do? It has two things that it could do. When you're firing a higher amount of energy, deeper, meaning the needle tip is in the fat, you're actually killing fat cells. So if you have a little jowl, you can kill some of the fat that's in that jowl, or a little extra fat in the neck or other areas. It'll reduce fat by killing fat. Now, historically, the big problem is in an aging face, when you reduce fat, you're left with more loose tissues. So that's not a good thing necessarily. So what Morpheus does that makes it a game changer a bit in the minimally invasive cosmetic medicine is that it tightens. The energy when the needle is not enough to kill fat, but enough to stimulate collagen, is grounding from the tip of the needle to the plate at 4, 3, 2, or 1 millimeter, causing an overall tightening effect, meaning your own collagen is actually going to grow in the next 3 to 6 weeks after the treatment and cause a tightening of the tissues. What's really amazing about Morpheus is for people that fillers have maxed out or they don't want fillers for whatever reason, and people that don't want facelifts. So somebody like me who wants to improve their lower face, their neck, so many people sort of early in the aging process in their 30s, men or women, and it's just an amazing procedure to be able to see a tightening effect without surgery. So that's why I see it as a treatment with a really big future.